Okay, I will now call the Graham County Board of Health meeting to order. Next Monday, February 1st. Happy February to everybody. And do I hear a motion here? Everybody has holy days to be closed. If the knock was closed in all.
The computer says it's not on.
Betty, can you hear me now?
That's better.
Oh, okay. Well, I will call the meeting to order for the Graham County Board of Health. This Monday, the 1st of February, 2021. And I will entertain a motion for the approval of the agenda.
So moved.
Thank you, Commissioner Wiggett. Do I hear a second?
Second.
Thank you. All in favor? Has everyone had a chance to look at the regular minutes for November the 2nd, 2020, or does anyone need any further time for that? Okay, I'll entertain a motion for the approval of the November 2nd, 2020 minutes for the Graham County Board of Health.
Motion.
Thank you. Is there a second? All in favor? Do we have anyone for public comment? There is no public comment. Okay, I will now turn the meeting over to our health director, Beth Booth. Hi, can you guys hear me okay? Can you hear me better?
Yes.
Okay. Okay, so the first up on the agenda is the updated Board of Health menu for 2021. I sent the board members those changes. The only thing that changed were the dates for the meeting, and then the order for the commissioners, because my board didn't turn it this year. So those are the only changes. Otherwise, there was no updates to the Board of Health manual for 2021. New employees, we have two new peer support specialist positions finally moved forward. And that was Clint Jones and Bethany Leonard. They both are going to be serving as peer support specialists, but their roles are a little bit different. So the community linkage to care was the grant that was 29 hours a week and was working with the justice involved. So he is working, he's actually now stationed at the jail with the sheriff's office, and that is going very, very well. The feedback that I'm getting is very good. They both started their peer support specialist training this morning. So that's a 40-hour training for this week, and then we have to do another 40 hours of one hands kind of work. So that all started this morning. Bethany Leonard is actually stationed out of the health department. Hers is the ARC grant, so she is 40 hours a week. Also doing very, very well. She is working closely with ANCHC and Mount Holland. So there is a meeting February 11th to introduce both of them to the Graham County businesses and start to kind of get that position on the ground. So those are the two new positions. Does anybody have any questions with either one of them? I would just say congratulations on these hires. I think both of them will do very well. And I'm just looking for all good things for this program. They're both really excited, which is good, because that's going to be kind of an uphill battle with those kind of positions, is that excitement. So they were both very excited to start. And then AMCHC was very happy to have them. So they are doing very, very well. The 2021 strategic plan also went out by email. If you guys have any questions about it, by all means, just ask. The weather's pretty nasty outside, so we're going to try to make this as brief as possible. There wasn't really any updates or changes because this is the last year of the community health assessment cycle. So the new community health assessment will come out in 2021. So this is the last year of this cycle, and we will be doing some community focus groups and some community leadership meetings to establish what we want to achieve for the 2021 community health assessment cycle. So let's see if I can find one. So that's, anybody have any questions with the strategic plan? Okay, and we'll read it through the flu update.
continue to have sufficient supply of flu vaccines, so we're still encouraging providers to refer clients to the health department. We have a good supply, I think that still of the adult vaccine that's free for those that are uninsured, available at the health department. We definitely want people to get vaccinated for the flu. Right now, the flu numbers statewide that we're receiving are down. I don't know how much of that's related to everyone's being tested for COVID and not for flu. We have saw some cases of flu in Graham County through urgent care in the clinic that are testing both for COVID and flu. We're seeing type A and type B, and for a few individuals, they've had both, which is miserable. So, and do you want me to go into the COVID?
Yeah, you
Okay. Our COVID numbers, I don't even want to hardly say it out loud. I don't want to jinx it. This last week was not too terrible for positive rates. We're, I think, around 540, maybe 530, 540 for our positive cases. Our active cases are probably around 35 to 40 right now. So we've had several that we've been able to release. One trend we're noticing is individuals are much sicker now with COVID than what they were initially. We are seeing very, very few cases of asymptomatic people that are testing positive for COVID. That's pretty much rare now. The individuals that I've been doing case follow-up with are sick, very sick. I think we may have, I was out Friday, so I may be wrong on this, but last that I knew of, we had 2 positive cases hospitalized. Have you got any updates on that? So, COVID vaccine is going. We wish we were getting more from the state. We're still getting 100 doses, first doses each week. Which we're thankful for that because some counties did not get any the last go around. We are also getting second doses in, which we're very thankful for that. And we're following people as they're getting their doses to see how they're doing with it.
Is there a difference in the first dose and the second dose?
Just inventory. But it's the same brand, it's Moderna, and it's the same ingredients. The side effects are a little bit different.
Well, I'm like that. It's the same thing that the income thing, the second shot.
The first dose primes your immune system. The way the mRNA works, it primes your immune system. It lets your immune system know that COVID has arrived, even though COVID is not in the vaccine. One of the characteristics of the mRNA vaccine is it's very similar to the COVID virus. It has a very similar makeup, and it cannot give you COVID because it's not a kill or a live virus. It just mimics COVID. So it causes your immune system to start developing antibodies to COVID, and when you get the second dose, then your body has already been primed, your immune system, and recognizes, hey, COVID's on board, our army needs to attack, and that helps give you that lasting immunity. So, and I had my second dose and intact. But it's a good thing. Fevers, as long as the fever is low grade, and most of my symptoms, you manage at home. My fever did go a little bit higher than what I anticipated, and I tried to withhold taking Tylenol or any other Motrin because I didn't want to suppress that immune response. So it was a little bit more difficult than I anticipated, but some people do great with it. So it's just your individual immune system.
How long did your symptoms last?
About the worst of it was about 24 hours, and then I started feeling better. My fever got to 103, which is I should have taken Tylenol, and I did right away. So, but it let me know that my body had already started developing antibodies. I had the muscle aches, I had the headache, but by the second day, I started to feel better, and the third day, much better. So, it wasn't as bad as COVID, but the thing that I kept thinking was, what if I actually did have COVID? If I got, these types of symptoms from the vaccine, then COVID would be much worse.
And you're saying that the COVID symptoms now are much worse than in the beginning?
They are. Our clients that we're talking to that have tested positive are miserable for several days. Yeah. Lots of muscle aches, lots of back pain, respiratory breathing problems. The respiratory issues are appearing to be worse clinically than what we saw initially. Some of it can be individualized. We know the strains mutating and changing as it goes through the population. And it's flu season. You can't have more than one viral illness, and it could be that some individuals may have both. They may have bronchitis, but we are seeing the respiratory issues worse. Still, children seem to be faring, thank the Lord, they seem to be faring very well with it from what we're hearing.
Yeah, still,
We have done 705 first doses and 20 second doses, so total we've done 725 vaccines. And we seem to be getting ahead of the list, finally. It only took a month. But the number on the list is finally starting to go down faster than it's going up. We started the day right at about 900, and we ended the day right around 820. So we're slowly but surely carving down the list some. So we're hoping to have the list pretty much eliminated and be caught up. Probably we're hoping within the next 8 weeks, because we get 100 doses a week. The list is obviously going to keep growing, but with the clinic now vaccinated, we're hoping we'll be able to weed through that list within the next couple of months and be completely caught up. Not hold it. That's a goal. It might be a high one, but we always shoot high. So, any other questions with the virus or the vaccine or?
probably just, that's what I was fixing to ask, is what these things would, was it fixing to balance out to where you could be able to see daylight, because I know, I've heard some people, call and complaining about it, and causing y'all grief and stuff over things that y'all don't have no control of. And I don't think it's kind of, y'all just do what you can, especially when they're just sending 100 doses a week. I mean, that's 100 people, but you've got 1,000 people that want it, you've got to take it straight out. You got to do what you got to do.
That's right. And the clinic has held their 200 doses has held a pretty significant amount of turning the corner on it, because when you only get 100 doses a week and every day we add probably 30 to 40 people, that 100 doses wasn't making a dent in that list. It was just growing and growing and growing. It was honestly becoming pretty overwhelming. And so when the clinic got their 200, we finally were able to start carving that list down faster than it was going up, which was really, really helpful. And so we are, a lot of people ask, where am I at on the list? We are telling them numerically where they're at. It's just a spreadsheet. That number changes by the hour as I slowly make my way through. I'm making all of the appointments in case anybody asks. And I'm sorting the list by date of birth. That seems to be the most fair thing to do. We get questions about essential employees. That list, or that group was open when COVID vaccine first came out, and then the state closed it. So we got calls from citizens that are essential employees that didn't get in that first round, and then it closed. So their colleagues were vaccinated and they were not, and at this point, there's nothing we can do about it, and the group is closed. It is the next upcoming group. So you've got your healthcare workers were in the first group, over 65 is in the second group. We're at about 1980 or 1948 is where I'm at right now. So if folks are asking and they're, I'm 70 or whatever, I'm getting there. I'm just about there. So I'm at about 1948 right now. But the next group is the essential employees. We do get a lot of calls from folks that are in their 50s, their 40s, I have cancer, I have, this or that, and while it's tragic, that we're just not allowed to vaccinate them. And unfortunately, they're not even the next group. Your high-risk adults come after your essential employees. So I don't think that the essential employee group will stay open as long as the older adult group has, as far as go ahead and change down to the older or the adults with significant illness. I'm hoping there won't be quite as big of a lag in between those two groups like there has between the over 65 and the essential employees. But we have no control over that. To my knowledge, I don't think we've got any feedback on the state in that essential group opening. We were very lucky in that we got a pretty significant number of essential employees vaccinated before it closed, but we didn't get all of them. So we've tried to get the ones that are over 65 and an essential employee, even though they're not, in those older birthdays, I have tried to kind of carve them out and go ahead and vaccinate them, but we haven't been able to get to the younger essential employees yet. So we're hoping that will happen soon. Also on your agenda, you'll see search staff. We do have Pat Collins and Robin Mason with us, who have been a huge, huge help. And they've been a huge help because they are the ones that are actually calling the day before and doing their medical screens. And they're the ones that are putting everything into CDMS for us. So while the nurses are doing the actual vaccinations, Pat is doing the front end and Robin is doing the back end. So it's been a lifesaver, honestly, that we have been able to vaccinate. There's going to be 2 days next week where we have 80 people on the schedule, and there's just no way we could pull something like that off without them. So we're pushing the limits of our capacity, but we'll get it done. So yeah, we have 2 days next week to have right now 80 clients. So we'll bust it out just like we always do. So any questions with the COVID or the search staff or any of that?
Becky has a question. Can you ask them if the clinic did a mass event this weekend and how many doses they got and how many they administered?
Okay, I know they got 200 doses. I do not know how many they administered. And I do know they did it on Saturday. Oh, yes, Jill. Yay, Jill can answer it.
Administered 118 and they had 40 doses left, but the rest of them went to Leicester, and I think total we did like 560 total between Leicester Clinic and our clinic. But for Grant County, we did 118, and we have 40 additional doses for this week with a plan to get another 100 doses next week.
And we greatly appreciate that.
Another question, how are you managing the second doses? That cuts when you have people coming in for their second doses, cuts the number of potential people that you can vaccinate in half. How are you managing that, and will you guarantee the right amount of vaccine? Probably not guaranteed.
Right now, we are guaranteed the same amount of vaccine. Our first dose, folks were being vaccinated by Sean and Linda, and Loretta and Megan were doing the positive cases and all the contact follow-up, and contact tracing and follow, isolation and quarantine letters and all that kind of stuff. So I was only using half of my nursing staff for actual vaccinations. So, and we haven't done a whole lot of second shots yet. Like I said, from the thing, it was only, I think, 20 doses that we've actually done second shots right now. Next week is that big week where we have a big surge in the number of vaccines that we were doing, and we went up to 60 a day. So next week is when we're going to pull in Megan and Marina to start vaccinating as well. And at that point, we can get up to 80 to 100 vaccines a day. Okay, and then the 100, okay, so the dosing. So we are guaranteed our vaccine. This is the big thing that they put out on the media, and a scare tactic, if that's what you want to call it. We have had no problem getting our second doses, none. They come, our first doses come usually, we hope Tuesday. Of course, it's snowing, so we're hoping Tuesday. And then our second doses come on Thursday. And that's been that way since we started this endeavor. So we have no concerns with second dose versus first dose. We have plenty of second dose in the freezer. It's just waiting for those appointments to come up. So yes, we're excellent as far as the timing of our shipments. We're good.
Thanks.
No problem. Any other questions with COVID? All right, so switching gears completely, and Lord knows we get tired of talking about COVID anyway. So environmental health, going extremely well. I guess because of COVID and the civil unrest and the riots and everything else, our housing market exploded. I'm sure everyone noticed. And that didn't carve out the people buying property as well. So we have already exceeded our projected revenue for septic inspections. We exceeded it, I think, by $6,000 already, and we're already halfway through the year. So we also saw more, I think, well applications. So it's going very, very well for environmental health. Allie is completely certified. She's waiting on her well authorization, but then the weather has kind of messed us up. But otherwise, she's completely done with all of her authorizations, and she passed her test. So environmental health is going very, very well. Does anybody have any questions with environmental health? All right. So Harris Tele OB practice update. They should be arriving probably pretty soon. They're going to be here on the first and third Wednesdays of the month for a half a day. They haven't decided if they want to be in the mornings or the afternoons yet. They haven't gone back to us on that. They have purchased all the equipment. So it will be Harris's practice inside the health department. It's too complicated for us to do all the billing and the visits and that kind of stuff, and it honestly is more of a burden on the client to do it that way. So Harris is going to send their own staff with their own equipment, and they're going to do the OB visits in our offices, or our exam rooms. So they're going to be able to do ultrasounds, and they're going to be able to see them, I think, up to 32 weeks in our office. So the folks which is excellent since Erlanger is no longer delivering babies. So folks are either having to go all the way to Union or all the way to Harris. And so we have actually opened it also to Cherokee County, which Cherokee County Health Department also does maternity care. But if it's somebody with an injury or more on this side, they're welcome to come here. And then also you have Swain, and Swain doesn't do, I don't think they really do OB at their hospital. So if they live in Almond or if they live in Bryson, it may even still be closer for them to come here for their maternity care rather than go elsewhere. So we hope that will take off here pretty soon, probably. So any questions with the OB practice? That's something that's been going probably for about a year now that we've been negotiating that road. So yeah, we're pretty excited about that. And I'm pretty excited for all of the pregnant women in our county to actually be able to get close, high quality care through 32 weeks. So they won't have to go all the way to us. So that's good. The Erlanger School-Based Health Center, that was actually kind of dead in the water for a little while, but got a pretty big jump start. They have been fully funded. So they are hoping to start the School-Based Health Center next school year. And that, again, is going to be, we have no involvement with that financially, That was just a school contacted me, wanted to get it back off the ground, and so I handed them over to Erlacher. So we have a hand in it, but no real stock in it. So they have been going back and forth. We've been in on the meetings, but they are now fully funded. And they're hoping for next school year, but that's something that they're having to work out the kinks and the space and work on the provider and that kind of stuff and how they're going to staff it. So they haven't completely nailed that down yet, but they've got obviously a good little while before next school year. So that's what they're shooting for if everything works out the way that they're hoping it will. So I'll have probably more updates and more solidification on that as it kind of goes a little bit forward. But right now, our lumber is, like I say, kind of where Harris was last summer, kind of working out the logistics of it and that kind of thing. So we'll probably have a little more solid if that moves forward. So, any questions with the Erlacher? All right. So, what everybody loves to hate, which is the budget process. So the budget process is going to be very interesting for this fiscal year. I sent it to y'all for your review, and obviously the weather is completely nasty, so we're not going to do this line by line, and Lord knows we all don't want that kind of torture. So all I've done is taken the revenue lines from last year because we do not have our agreement agendas yet, so I don't know how much the money the state's giving us right now. We usually get those middle to end of February, so we're usually around Valentine's Day, but it's COVID, so I don't know when we'll get them. So the revenue lines have been adjusted for local revenue depending on what this current year looked like. So if we were sitting right about 50–60%, I left the revenue lines alone. If it looked like it was going up, I went up. If it looked like it was going down, I went down. So that was all I did with that. The salaries, you'll notice a lot of these, well, this one's classic. So child health went down by $15,000 from last fiscal year. You had 47 this year, 34 for next year, because all of these programs that are high in nursing salary, like your child health, adult health, family planning, a lot of that salary got dumped into COVID for this coming fiscal year. The COVID budget was strictly based on the fact that I asked Stephanie Jones and Maria Eller how much time they thought their staff, clerical and clinical, would put into COVID. They both said 50%. So the COVID numbers, which are on the last sheet, I think, they are drawn from salary lines at 50%. So if you run into any questions as you look through this, by all means, just give me a call. I took down the dental Medicaid, even though their reimbursement has gone up by 5% for, I think it goes through the end of March, but I'm hoping they'll maybe extend that a little bit. The problem is, I don't know what kind of revenue we're going to get. I don't know what kind of revenue we're going to get, depending on what COVID does, really. So I tried to be sort of conservative with dental moving forward. So CC4C hasn't changed. This is general health, obviously, our only revenue lines there. You notice it went down by about $14,000. That was because most of that salary came out of that budget. Immunization program cut by $50,000 again because most of it went to COVID. So it's the salaries didn't change. It just all went to COVID. So, and that was the last program on here. So if, like I said, if you run into any questions with these, by all means, just stop by my office or give me a call and we can walk through them one line at a time or whatever you need help with. So any questions with the 2021 budget in the shape that it's in right now? All right, let's see. Let me make sure we're going in order here. All right, financial report. So, it's going to pop up. Let me make it bigger for you. There we go. All right, so communicable disease. You'll notice most of these programs, the year-to-date budget used is running low because of COVID. And I think it was the last time we met as well. So your revenues, child health is obviously way down, so that's the reason I took that local revenue line down, pretty significant amount. And then maternal health is running right about where it should. Pregnancy care management, while we've drawn money for that program, we are not using any of that money right now because that is Lorita's salary, who is all going to COVID. TV is running right about where it should. Family planning is running a little bit low. We had to close, obviously, the program when COVID first hit in March, and then we had some more issues around people getting sick and that kind of stuff. So, but we are expecting that program to actually have some more because of COVID, surrounding counties have shut down all of their clinics. We continue to run a full set of clinics on it in addition to all of our vaccines because we don't think the clinics should have to go anywhere because of COVID. These young ladies still need all of their care that they needed before COVID. So, whereas Macon County and I think Cherokee County both have shut down their family planning clinics, so we are getting their folks. They're making their referrals to our clinics. So we may actually see an expansion in our family planning to accommodate the surrounding counties. So environmental health, as you can see, is at 107.7% of its revenue at halfway through the year, so that shows good for your economy. 116% for CAP, I didn't go up on that, their reimbursement went up. So their reimbursement per person has increased. Dental obviously went down, they shut down for almost 2 months, so that was fully expected. Child service coordination, again, we're getting that money, but we're not drawing down a whole lot of it. As you can see, only at 24% because that's Emily, and she's my preparedness coordinator, and Lord forbid, that's all she does is COVID. So she's the one that's doing all of our reports and all of our, really, a lot of our administrative management of COVID funds right now comes through Emily because of the reporting. So, general health, that's just drawing out state funds. The immunization action plan, we actually have done, in addition to COVID vaccine, more vaccine than we did last year. So that was kind of surprising, but we have. WIC is running where WIC should run. We haven't drawn down a lot of the breastfeeding funds, and that's something I can take down with the staff. Food and lodging, this is just because food and lodging, there was no festivals this year. So the food trucks and the temporary food establishments, that kind of thing, it never happened. So we won't be making anything on food and lodging this year. And I did take those revenue lines down for next year because I don't see that changing. I'm hoping it will, but I'm also pessimistic. So we're going to go with no. And then adult health is sitting right where it should. COVID, obviously we didn't really have a COVID budget to start with as far as revenue line. So that one's going to look kind of whack regardless. So that's where we're sitting with the fiscal report. Does anybody have any questions with the financials? All right, what's up next? Productivity report. Okay, so let me close this one. Oh, maybe I can. Oh yeah, picture. So, stick with tables. I'm going down. You go up. Alright, so here's adult health. So we've gotten a lot of years in here, which is really good. So obviously here's January. For adult health, and the light blue is 2021. The darker blue on the bottom is 2017. So this will kind of give you an idea. We're actually running right about where we should for adult health in 2021, which kind of surprises me. I'm kind of shocked. BSEP, our BSEP numbers are going to be down because if you notice the purple lines, which was 2020, are really high. We're out of BSEP numbers. Are we totally out? Yeah, we're totally out of BSEP. And I say that because that is a state-funded program, and we are only given 21 slots. Yeah, and we use them all. So we can't do any more BSEP. We are in negotiations with the state to see if we can get our number increased. But we can't serve any more than the state lets us. So right in January, we served one, and I think that's our last one for this fiscal year. So we're going to, I think Sean actually stepped in today and said she was going to talk to the state about trying to get us some more, because we definitely need to start those ladies. So we're going to see if we can get that increased. Here's child health, obviously it's gonna fall off. This is, the dark purple again is 2020, and the numbers were down just because we don't do child health clinic anymore, and vaccine moved to a different program. So this is gonna, 2020 and 2021 are gonna give you a better idea of where we're gonna sit without, mixing in vaccine with that. All right, so here's our family planning. As you can see, 2020 was starting to end with it running a little high. It ran a little higher, and a lot higher in January, and I expect it to probably run high as long as we're taking clients from other places. So immunizations, as you can see, January was really high for very obvious reasons. So we'll see if those numbers continue to increase. This bar is really high because of flu shots that we did last year. So that's, those are immunizations. This is maternal health. These are just pregnancy tests. So that's the reason the kind of lines are kind of all over the place, because that's the only maternal health that we do. All right, here is Svd Clinic. Again, it's kind of all over the place. It goes by referral. So this depends on where we get the referrals. This is WIC, and actually, ironically, even though it looks like it's down because the state is doing auto issuance, our WIC numbers are actually up, not down. Because the state is auto issuing to benefits. So regardless of how many people we physically see in the building, they get issued to, so our numbers would actually increase. All right, and then this is dental clinic. As you can see, it's pretty much got a pretty natural flow of being higher in the fall, and then through the winter, and then dropping in the spring. January was down because the Dr. Frederick was out. So he just looks there to produce the numbers. And the same thing with the hygienist. She will not work if Dr. Frederick is not there. So her numbers are going to go down because Dr. Frederick was out. So, yeah. Anybody have any questions with the productivity? And if you want to see this spreadsheet, I can give it onto a PDF so it's not quite as wonky with moving around on the screen. And I can send you those numbers as well. It's kind of crowded, so some people don't like to mess with it. So, but if you want to see it, by all means, just ask, then I'll send it to you. All right. And community health surveys. I just got this information. Let's see. Because we just closed it out for 2020. Let's see if I can find it. There it is. All right. So, we go all the way back to the top. All right. So these are the 8 brackets of folks that answered. We had 129 surveys. Obviously, it was low, and that's because it was online, and we didn't have the opportunity to hand it out in person because the library wasn't open, that kind of thing. So we did our best to push it out as much as we could, and we did open it where you could take it multiple times from the same device in case somebody didn't have internet access, but their friend did, or didn't understand how to fill out the survey and needed help. So we're hoping maybe we can get some paper surveys this year. I don't know, we'll have to see. Depends on when things can open up. So this is kind of the age bracket of folks that answered the survey. And this is what people thought about their overall health. Obviously about 45% said very good. And then we had some fairs and some poors. And this is, what would you say is the condition of your mental health? Sadly enough, there's more pours on this than for physical health, which is kind of disappointing, but that's where they feel they're at. So that was for mental health. This is, do you suffer from any of the following? And the other responses, we had ADHD, PTSD, panic attacks, substance use. So that's what this green bar right here is, and that's where your other responses are, right over here. And we had a lot of anxiety, which we had anxiety last year too, at about 62%. So this is, do you know where to go for mental health? Most folks do. That kind of surprised me. First year that we did this survey, we always ask this question. And most folks are aware of where they can go for mental health, which is good. Have you ever been diagnosed with heart disease? This one surprises me because heart attacks are one of the leading causes of death in Grant County. But nobody ever answers yes to this question. And I'm not sure why. But it was low last year. So again, I'm not really sure, because it always is a big push for the county for like heart disease and diabetes, but folks are not claiming it, and I'm not really sure why. Do you smoke or vape? No. This was actually a pretty common response last year too. Over 80% of people that answered said they don't smoke or vape, so, which is really good. And then this is, do you want to stop? And then we need where to get help. And so this is, do you or someone you know misuse substances? And about 30% said someone I know, and about almost 10%, about 8 looks like, percent said they do, and then about 60% said no. And that's what we saw about last year, was about half and half. Half said yes, half said no. And then the yes was split between I do and someone I know. And this is, do you know where to go to get help? This one was more of the no. And I'm wondering if it's also because we just don't have those kind of services here. All you have like Teams group, and you have like Grace Place and things like that with no organized inpatient kind of care or even outpatient kind of care that's really intensive like that. So I'm wondering if that's why that no answer is a little higher.
But, do you feel like that the five might play a role in getting that information out to a larger group?
I think so. Them and ACS, and people are pretty polarized with ACS, but I think if they did a little more public awareness and public outreach and public literal reach, that may improve a little bit. And I'm hoping that once Bethany and Clint get off the ground and are touching those people either face to face or by telephone constantly, we'll see this change. That's a hope though.
Do we still have a mental health kiosk anywhere in the county?
It's in DSS's waiting room. I don't know that it's operational though. I'm not sure. That actually might be, well, I'm sure it's an ACS or a minor question, but Chris Weatherford may know a little bit more information on that.
And I'll go contact Shelley Foreman if I.
Sure, absolutely. All right, and then these are just some answers. Some of the questions are open-ended because we want to get feedback. So, if you could do one thing to improve the health of Grant County, what would it be? Some people want better communication, particularly with COVID. I'm not sure. We had discussed this. I'm not sure exactly what we can do to make it better. We are doing the best we can with it, but we don't have a lot of time for public outreach. And Becky and Connie and I have sat down on some media releases and that kind of thing. So that may be something that we sit down on a little bit more, especially if we can kind of get our vaccine clinics kind of smoothed out. That may help a little bit. Reduce illegal drugs, get drugs off the streets. You know, the health department can't really do that, but you know, we'll do what we can. This one's always a big one. This provide some place for young people to go. We get this every year. And basically something positive and not so negative. Again, I'm not sure from a health department perspective that there's a whole lot we can do about this, but this is something that we get a lot. And somebody else wanted the opposite as far as on the other end of the age spectrum, more check-ins with the elderly and the disabled. So again, I'm not sure who would take that on, but that is something that we have heard this year. We haven't actually gotten that one before. The other big ones, these are all about masks. People want people cited for not wearing masks. They want citations for not wearing masks. And stop gathering in groups. We got a lot of that kind of push, public enforcements, that kind of stuff. We're not there as a county, and so I don't think some of the folks that are very pro-mask and pro-mandate haven't quite grasped that. So we do get a lot of pushback from people that either are visiting or have moved here regarding the masks and the mask mandate and the fact that people don't wear masks. So that's feedback that we hear pretty often. And the mental health crisis, we do get that one pretty much every time. Here's another one about the kids having something to do. Get rid of drug dealers. We have had some questions as far as diabetes classes. And this is pretty rare. The problem with diabetes classes is you have to have participation in order to fund them, because the CDC will fund diabetes classes, except where you have to have a pretty significant participation, and that's not something that we could guarantee. So that's something that folks have a question about, but it is something that we might look into after this kind of settles down a little bit. We do get a lot of requests for gym. That is something that you'll see on here a lot. And then public recreation, which sort of goes back to your gym. Public recreation, substance use, and somewhere for kids to go. Those are the ones that we hear over and over and over again. So that's where you're going to see most of these is in that. And if you could, comments or suggestions, the masks. People are always asking us about the masks. And we do get a lot of positive feedback. Good job. Thank you for all your hard work. We really appreciate that kind of feedback, especially right now. So, yeah. So we do appreciate all the feedback that we got from the community surveys this year. So, anybody have any questions on the surveys? And again, if you want this information right now, it's on the spreadsheet, and like I said, it looks kind of jumbled up a little bit, and I can put it onto a PDF to make it a little more user-friendly if you want to copy it. So. All right, and I think that comes to the end. Look, I crammed all that in 50 minutes. That was a lot. I feel like I talked way too fast, and I feel like I talked way too fast. I'm sorry. We're trying to get out of here before the ice sets into that, but my office door is always open and my phone line is always open. So if any of it was confusing or you couldn't hear well or you just got any questions that you wanted to ask but you don't want to ask them in public, you're more than welcome to give me a call and we'll get it sorted out. So, all right. Any general comments, questions?
Happy early birthday.
Yes, my birthday is tomorrow. I turn 40. Yes, 40 is not a good year for me. It's going to be a good year for me.
I'm gonna put that in minutes.
Yeah.
Yes, be sure it's on.
Absolutely.
29 and holding, or
29 home, that's right.
you've already gotten there?
Any other questions? All right, other than that, just publicly, I want to recognize my staff for the phenomenal job that they do every single day and basically kill themselves for this county. And I just wanted to know how much I appreciate everything they do, because they have worked themselves to death for a year, and now I want even more out of them than I wanted a year ago today. So, just anytime you see any of my staff, please thank them. It goes a long way right now because they're very stressed out for obvious reasons, and we get a lot of complaints. When am I up? You guys think so and so and not me. I don't understand. So if you see them, give them a hug, an air hug. Yeah, and tell them how much you appreciate them, because it's rough right now. So they appreciate it.
I've heard a lot of good comments from people that have been getting their vaccine. I haven't had any good comment yet from anybody that they're just very impressed from the time they arrived through the whole experience. Very happy.
And I'd say Ronnie and Tim, that we love us some Ronnie and Tim. They do a great job.
Yeah. Those are two good ones to start with.
Yes, they are two good ones to start with, and we have we've enjoyed having them, and we appreciate having them.
You got some good PR people out there.
Yeah, yes, absolutely. I would completely agree with that.
Okay, thank you, Beth.
Say,
Is there any old or new business to be addressed?
No.
Okay. If there's nothing further, I will entertain a motion to adjourn this meeting.
So moved.
Thank you, Sharon. Okay. Second with, Commissioner Neal, all in favor? We are adjourned.